Case 6 is ventricular septal defect. Sam is a 7-year-old boy who looks well grown for his age. On examination, he is not cyanosed or clubbed and has no respiratory distress. His pulses are normal with a rate of 75 beats per minute. There is 3 or 6 pansystolic murmur that I can heard all over his precordium. There is no radiation and no variation with posture and expiration. There is no other detectable heart murmur. His heart sounds are normal. His apex beat is normal. He has the clinical findings suggestive of small ventricular septal defect. I would like to plot his growth on the growth chart, and I would like to check his blood pressure. So the treatment depends upon size of the lesion and symptomatic. Either the child is symptomatic or non-symptomatic. Treatment. The aims of treatment are 3. Number 1, to control congestive cardiac failure. Number 2, to prevent pulmonary vascular disease, pulmonary hypertension. And number 3, to maintain optimal growth using high caloric diet. The treatment used, medical treatment used in the VSD is diuretics and ACE inhibitors. For indication of surgery depends upon the size and symptoms. If the shunt is significant and not responding to medical management, surgery is indicated. The size of the intracardiac shunt is expressed by ratio of pulmonary to systemic blood flow. If pulmonary blood and systemic blood flow ratio is 2:1, it is normal. But if it is above 2:1, so if persistent pulmonary and to systemic flow ratio is greater than 2:1, surgery is indicated, because it will lead to left atrial and left ventricular volume overload, and also can develop pulmonary hypertension, so leading to Eisenmenger syndrome. In complicated cases of the patient who are not suitable for early surgery, pulmonary artery banding can be done, like multiple VSDs, Swiss cheese defects. If infant need medical management, VSD is repaired before 6 months. In Down syndrome, before 3 months. For a moderate defect, if the growth is normal and no medical management is required, they may have surgical repair in preschool years, 2 to 5 years. For very small defects, watch and wait treatment policy is adapted.